In 2023, we secured money from Macmillan and from the North East London Cancer Alliance to increase our psycho-oncology workforce across North East London so that we could then start delivering more equitable psychological care. Some of our hospitals had a lot of psychological specialists on site. Some of them had nothing. And what that meant is that if a cancer patient was being treated here, then they would need to travel all the way into the City of London to St Bartholomew's to receive any psychological care.
Going into the kind of treatment that I oversee is challenging at the best of times, and having good reserves mentally and physically beforehand can be really important factors for engagement in the treatment, being able to withstand the side effects and feeling supported through it. In this area, there is a lot of poverty and a lot of hardship that can make accessing treatment very, very difficult. Even travelling beyond 5 miles is almost impossible. So having access to things on their doorstep, in the hospital that they know they've already been through for diagnostics, they've already met a nurse or they have a point of contact, it keeps it personalised.
With the additional funding, we've been able to have staff located at all of the hospital sites delivering cancer care across North East London.
The kind of work that we've been able to do and the number of patients we've been able to see has just made a massive difference in this last year. I think it can be really different for different people, the point where they really feel that they want to reach out for that support. Because we're here and we're connected in with the clinical teams in the hospital, it makes it much more accessible and much more possible for people to say, actually, you know what, I think now's the time I need to get a referral in to reach out for that support.
Being told you have cancer is one of the hardest things you will ever be told. My psychologist has given me strategies to deal with moments of anxiety. Every couple of weeks, you look forward to talking to a stranger, to my safe space. And I know that when I leave there, the sun is shining. Before this, I would go every moment thinking about it. And those feelings are slowly going away.
If you're wanting to see someone weekly and build up that therapeutic relationship, having it in a place which is accessible and it's nearby their home, it just makes a massive, massive difference. It's not just about talking about the experience, but it's about thinking, well, how do I adjust to this huge change in my life? You know, how does that impact, when I go back home and I have my relationships with people in my family, what does that mean for going back to work or wanting to engage in a job if I get to that kind of place again?
We wanted to be able to provide to all of our cancer and palliative care nurse specialists support through what we call clinical discussion groups, which is a space that they can come each month in a group to enhance their psychological skills and also to think about their well-being.
Having the capacity to support the groups means that we can spread out that psychological support amongst all patients, even the people that aren't immediately accessing kind of one-to-one therapy or psychological groups.
The clinical discussion groups make a huge difference to the staff. I mean, it's a safe space for staff who are dealing with, complex situations, and it can be really emotionally draining.
It really feels like we've come a long way. We've been able to diversify the offering, so not just delivering individual therapy, delivering groups. We have been able to run fear of cancer recurrence workshops, have art therapy. We've been able to give people choice, and I think there's always more to be done. We're starting to think about people who are coming into cancer services with a learning difficulty, our teenage and young adult population, so everybody has access to the appropriate psychological care that they need.